Hello, thank you for listening to this training video on the use of a new diabetes risk assessment tool for health promotion. In this presentation, I will provide some information on diabetes and its relevance to the intellectual and developmental disability population, or IDD, which the Special Olympics athletes are a part of. Then I will explain the protocol for using the assessment tool as a volunteer at Health Promotion. And finally, I will provide some suggestions and talking points for rephrasing questions and interacting with Special Olympics athletes. Diabetes is a chronic health disease that causes blood sugar to be in an unsafe range. There is type 1 diabetes, which is insulin deficiency caused by the pancreas's inability to produce enough insulin to bring sugar from carbohydrates into the cells, resulting in a rise in blood sugar levels. Type 2 diabetes is insulin resistance, which is caused by a multitude of reasons, including obesity, which is prevalent in this population. Type 2 is the more relevant type of diabetes for this population, and persons with IDD are estimated to be 2 to 3 times more likely to develop diabetes compared to those without IDD. This increased risk is related to boundaries to accessing appropriate medical care, other comorbidities or existing and health-related conditions, genetics, lifestyle, and more. Including a diabetes risk assessment screening as part of health promotion will help to improve outcomes for the athletes by identifying those with diabetes who are not receiving care and those who are at risk for developing diabetes, where we can connect them to resources to decrease their risk. Here is a picture of what the assessment tool looks like. You can refer back to this picture at any point after you complete the video. To begin an assessment with an athlete, greet the athlete and obtain their name, a good phone number, and delegation. Write this information on the top of the form. You can verify their name and phone number with their health promotion screening sheet or passport if they have it with them. Next, explain to the athlete that the intention of the assessment is to see if they are at risk for diabetes, and explain what diabetes is by using the information previously reviewed in this training video. You should first look at the health promotion screening sheet to see if the question, has a doctor or healthcare professional ever told you that you have diabetes, is answered. If this question is not answered, that should be your first question to ask the athlete. If that answer is yes, then you do not need to proceed with the assessment. If the answer is no, then continue with the assessment. Ask the questions in order, numbers 1 through 7. You can obtain their height and weight from the health promotion screening sheet, as this should have already been recorded. Based on the results of the assessment, you will place the corresponding sticker on their passport and explain to them what their results mean. First, I will offer an example of a talking point for an at-risk result. You can say, you are at risk for diabetes because of your family history, age, and high blood pressure. It is important to maintain a healthy lifestyle so that you can continue to safely participate in your sport. As you review the assessment, if they score a 5 or higher with their answers, that means they are at risk. A second example of a talking point for an athlete with diabetes is the following. You are identified as having diabetes, but without a doctor or management resources. It is important to have routine care to make sure you are healthy and can continue to safely participate in your sport. Lastly, if the athlete is not found to be at risk, you should provide encouragement and tell them to keep up the great work with being healthy and active. Regardless of the assessment result, you should indicate that SOPA will follow up with them to provide resources. This is also noted on the sticker, as you can see in the images on the slide. Here are some suggestions for phrasing adjustments of your wording as you work through these questions with an athlete. You can refer to diabetes as high blood sugar. And you can ask if they or someone they know monitor their blood sugar before eating. You can also ask if someone they know pricks their finger or wears something on their body. You can ask if a woman has ever been pregnant for gestational diabetes. And you can ask if they were told that they had high blood sugar during that pregnancy. Blood pressure, height, and weight are recorded as part of the health promotion screening, and so you can refer to the athlete's sheet to note this information. You can also ask if they have any questions about what was recorded. Finally, physical activity is reviewed and monitored on the screening sheet. If for some reason that information is not included during your health promotion event, you should ask follow-up questions to gauge their activity outside of training for their sport. What type of activities do they do outside of training for their sport? Do they have a job that involves walking? What type of exercises do they enjoy doing? These are just examples, and each follow-up question should be individualized based on how your conversation is going. An important aspect of this training is understanding how to interact with Special Olympics athletes, especially if this is your first time volunteering. Here are some tips to remember. You should have a good, sensitive human relations skills. Think about how you would want someone to treat you and use that response to gauge your personal interactions with them. Do not hesitate to respectfully ask the person to repeat what they said slowly or more clearly. Your goal is to achieve answers to the assessment questions through a conversation, and while this may take a bit longer, it is important to get the most accurate responses as possible. Along the same lines, consider using simpler language and slowing down your pace of speech so that the athlete can best understand you and answer you. Finally, allow the athlete time to answer and do not put words in their mouths. Using these tips will help you to have a successful volunteer experience while assessing athletes' risk for developing diabetes. Thank you for listening.